Hello, my name is Ashish Bhimani. I'm one of the physicians specializing in heart rhythm disorders at Piedmont Heart Institute. Today I'd like to talk to you about atrial fibrillation risk factor management. Atrial fibrillation is generally a chronic and progressive condition. The episodes usually become more frequent and longer over time. And so it's important to know, though, that risk factor modification can prevent or reverse that progression. Now, I do want to mention that treatments are often still required, but the risk factor modification can be an important adjunct to that approach. Let's look at a schematic of how AFib typically progresses. So the orange bars here represent episodes of atrial fibrillation, and we start on the left with a single episode. So you may have an episode that lasts a few minutes and goes away on its own, and you may go months or years before another episodes occur. But then you may have more episodes occurring with a greater frequency, and the episodes may start lasting longer and longer. When those episodes are short and they come and go on their own, we call that paroxysmal AFib. When the episodes are longer, lasting more than 7 days, we call it persistent, and sometimes that can continue progressing to a permanent or chronic AFib state. Now, what I want to talk about today is that part of the goal of treatment is to prevent that progression, and in some cases even reverse that progression. And risk factor management can be an important part in doing that. The modifiable risk factors for atrial fibrillation are as follows: an unhealthy body weight, a sedentary lifestyle, alcohol use, high blood pressure, diabetes, and sleep apnea. For patients who are overweight, weight loss can be the single best strategy to help prevent or reverse the progression of atrial fibrillation. I want to show you a study that they did where they took patients, treated them for atrial fibrillation, and then also put them on a concurrent weight management strategy. So we take 10 patients with AFib who have a BMI of greater than 27, and after 4 years, they've had their AFib treatment, whether that's drugs or a procedure, and they were unable to achieve any weight loss. Well, only 4 of those 10 folks are going to remain in normal rhythm, whereas 6 of the 10 unfortunately have gone back into atrial fibrillation. Now, if we take the group that had some weight loss, they were able to lose 3 to 9% of their weight, we have a much better success. Now, 7 of the 10 patients have been able to maintain normal rhythm, whereas only 3 have gone back into atrial fibrillation. Now we can look at the group that has the most weight loss. They lost more than 10% of their weight, and incredibly, 9 out of the 10 were able to stay in normal rhythm, whereas only 1 out of the 10 was back in atrial fibrillation at the 4-year mark. And so certainly our goal for patients who are overweight is to try to achieve that 10% weight loss. Now, exercise is another important component of atrial fibrillation risk factor management. Now, some people are doing no exercise, and so we want to build that up slowly. Things that are simple like walking or lifting some light weights. Really thinking about an age and ability matched exercise program. But you want it to be regular, so 3 to 5 days a week, with a low to moderate intensity is generally the best. If you can, work your way up to do 60 to 200 minutes a week, and you want to have a good mix of both aerobic and strength training. Now, all of these can improve your overall health and lead to a number of factors that ultimately lead to a reduced burden of atrial fibrillation. Alcohol can be another important risk factor for atrial fibrillation. Some people have an acute sensitivity, so even 1 or 2 drinks can trigger an episode of AFib. But for most people, it takes a little more to have an increased risk. It seems that somewhere between 7 to 10 drinks a week does have an impact on your overall risk of atrial fibrillation. Here is a nice study that they looked at patients who had AFib and who had approximately about 10 drinks a week. They split them into 2 groups. One group they asked to stop drinking, whereas the other group was allowed to continue their normal drinking. The group that was asked to stop wasn't able to stop completely, but they did reduce from 10 drinks to about 2 drinks a week. And in doing so, only 53% of those patients had another episode of AFib in the next 6 months. Compare that to the group that continued drinking at their normal rate, 73% of those patients had an episode of AFib in the next 6 months. So clearly, if you have atrial fibrillation and you're drinking a significant amount of alcohol, if you can reduce how much you're drinking, that can certainly lower the amount of AFib episodes you're likely to have. The more you're able to reduce your alcohol consumption, the likely better it will be for reducing your AFib burden. The other AFib risk factors are a little harder to tease out exactly how much impact they have, but it's clear that treating hypertension, diabetes, and sleep apnea in combination with the other factors we talked about is going to continue to improve your overall results with your AFib management. A comprehensive approach to AFib requires a focus on risk factor modification. We are here to help if you or a loved one has AFib. We have providers and locations across the state, so please, for more information, call us or check out our website below.